Okay, so welcome back to this next video in which we are discussing tertiary lymphoid organogenesis. So we're just discussing the immune response at the moment, and I just want to make a correction to something I said in the previous video. So in the previous video I told you that B cells will differentiate into something that I'd made up called a plasminoblast. Okay, so it's almost right, but it's a plasmablast that they differentiate into, so get rid of the plasminoblast. I don't know what I was thinking. It should be a plasmablast. Okay, and then these plasmablasts, they divide and divide and divide, and then they differentiate into plasma cells, which are terminally differentiated, which then go into the blood and start producing antibody, and that's going to help with the destruction of the extracellular pathogen. Okay, so that completes our discussion of the humoral adaptive immune response. Let's now discuss cell-mediated adaptive immune responses. So we'll start off with the one that's more similar to the humoral adaptive immune response. We'll start off with this one where the intracellular pathogen is living within a phagosome. Okay, so why is this more similar? Well, it's because the pathogen is within a phagosome. So, when a professional antigen-presenting cell is infected with the intracellular pathogen, then it's its own fault basically, because it has phagocytosed the pathogen, and now the pathogen is laughing at the cell because it's living perfectly happy within that phagosome. However, some of the antigens of that pathogen may well end up being broken down by the antigen-presenting cell, and then some of them will be presented on its surface in MHC class 2. So antigen fragments will be put on the surface of the antigen-presenting cell in MHC class 2. So it's MHC class 2 again, and that's what's important and why it's similar to the humoral immune response. So understand this, that when you present an antigen fragment on your surface, if you got that antigen fragment from some endocytic vesicle or some phagosome or something that you had engulfed basically, and then it is put on MHC class 2. Whereas, as we're going to see, if the antigen is just within your cytoplasm, you put it on MHC class 1, and that's how the cytoplasmic intracellular pathogen is different from the extracellular and from these phagosome intracellular pathogens. Okay, so the antigen-presenting cell is presenting the antigen fragment on MHC class 2. It then goes to the lymph nodes and it's going to find, again, a naive CD4 positive T cell, because CD4 binds to MHC class 2. So it's going to go to the lymph node and it's going to search long and hard for a naive CD4 positive T cell, which has a perfect T cell receptor on its surface for this antigen fragment that you are presenting. Okay, what then happens is the naive CD4 positive T cell becomes activated and it differentiates into a T helper naught cell, abbreviated as TH0 there. Okay, then what happens is the T helper naught cell divides and divides and divides, so you get a whole population of these T helper naught cells, all of which have this identical T cell receptor which is armed against this antigen fragment that has been presented. Okay, right, so what will now happen is these will start differentiating into T helper 1 cells this time, rather than T helper 2 cells. And again, the process by which this happens is not understood. However, what does seem to be important is interleukin 2 seems to be important in driving the differentiation of T helper naught cells into T helper 1 cells. Okay, and again, the mechanisms by which you actually signify that there is an intracellular pathogen that's inside a phagosome, and therefore the T helper naught cells need to become T helper 1 cells rather than T helper 2 cells. That's not understood. We don't understand how the body decides that it has an intracellular phagosomal pathogen rather than an extracellular pathogen that it's phagocytosed. We don't understand that. Okay, so then what's going to happen is these T helper 1 cells are going to start chucking out interferon gamma. Well, actually, let me just put in another step, because this is actually going to be important for what we're about to discuss, which is tertiary lymphoid organogenesis. So these T helper 0 cells differentiate into T helper 1 cells, so you're producing loads and loads of T helper 1 cells, all of which have this T cell receptor which is armed against the antigen fragment from this intracellular phagosomal pathogen. Now what's going to happen is these T helper 1 cells are going to go into the blood, and they're going to get recruited basically from the blood into the actual area of inflammation. So they're going to pass the endothelium and they're going to go into the inflamed area. So they're going to be recruited. So leukocyte recruitment is going to occur. And this time it's specifically lymphocyte recruitment. We're recruiting these T helper 1 cells, and they're going to end up in the inflamed tissue. Okay, so in the inflamed tissue. Okay, so you start getting a new cell appearing in the inflamed tissue. You start getting these T helper 1 cells appearing in the inflamed tissue. Okay, now these are kind of like, you know, if we keep the analogy of chess, which I don't think I've even introduced in this video, but I have told you about in different videos. So I like to compare the immune system to a chess game. Okay, so the neutrophils are like the pawns of the chess game. They are these inexpensive, not very powerful cells that you just chuck out at the pathogen because you've got a huge number of them. Okay, and you don't really mind if they die. They're just, you know, it's a war of attrition basically. You fire them off. Then you recruit these beta cells later on in the acute inflammatory response. You recruit these macrophages, which are still part of the innate immune response, but they're at least somewhat more powerful than the neutrophils. So they might be a rook in chess. Whereas now we are starting to recruit lymphocytes. We're starting to recruit the bishops or the horses of the chess game. These are more powerful. Okay, so what are these going to come in and do? Well, they're going to start releasing interferon gamma. Okay, and what is interferon gamma? Well, it doesn't actually attack the pathogens directly. Instead, basically it is a signal to macrophages. It's the signal of take no prisoners. It is the permission that the macrophages have been waiting for to say that they are allowed to use brutal methods, basically. They're allowed to turn on far more deadly mechanisms. Now, why were they not allowed to use these deadly mechanisms before? Well, because some of them will lead to increased damage of your own tissue, basically. Some of these mechanisms that you're going to turn on are quite damaging to the tissue, the surrounding healthy human tissue. But now that we've got these T helper 1 cells here, you know, the pathogenic infection must be pretty bad if they're coming in. So they start giving out this command to say, forget it. Start using these horrible, brutal tactics. Fight fire with fire is basically the message. So, interferon gamma is going to act on the macrophages, and it's going to give them new rights, basically. It's going to give them the right to use horrible tactics to win this war, basically. Okay, so the macrophages double up their efforts to phagocytose these intracellular pathogens, and it increases the chance, at least, that the macrophages will destroy the intracellular pathogen that's living within the phagosome. As you will know if you know anything about tuberculosis, it rarely works in tuberculosis. Occasionally people can actually clear TB, but it's a very difficult one for the immune system to clear. Okay, but at least it does increase the ability of the macrophages to kill the intracellular pathogen that's living within the phagosome. Okay, so that's the response to these intracellular pathogens which are living within phagosomes. Now let's talk about the response to intracellular pathogens which are living within the cytoplasm of the cell. Okay, and this is quite different, so this is quite nice. Okay, nice and simple as well. So the antigen presenting cell in this case will actually get infected by the intracellular pathogen. So let's say it's a virus. The antigen-presenting cell will get infected by that, and then the antigens of that intracellular pathogen will just be floating around in the cytoplasm of the cell. Okay, so what the cell will do is it will break down these antigens, it will process them, and then it will take fragments and it will put them on its cell surface. This time, it will mount them on the major histocompatibility complex class 1 rather than the major histocompatibility complex class 2. And then what it will do is it will go in the lymphatic vessels to the lymph nodes, and it will present this now to naive CD8 positive T cells rather than naive CD4 positive T cells. So it finds a naive CD8 positive T cell. Okay, so CD8 is a molecule on the surface of certain T cells. Now, T cells either have CD4 on their surface or they have CD8 on their surface. You do not have T cells, at least not mature T cells, which have both on their surface. So you are either a CD4 positive T cell or you are a CD8 positive T cell. So the lymph nodes consist of a mixture of both CD4 positive T cells and also CD8 positive T cells. So the antigen-presenting cell with this antigen fragment on MHC class 1 will go into the lymph nodes and it will search for a CD8 positive naive T cell which has a T cell receptor which is complementary to the antigen fragment that it is presenting. Okay, now if it finds such a perfect naive CD8 positive T cell, then it will activate this naive CD8 positive T cell and it will cause the differentiation of this naive CD8 positive T cell into a cytotoxic T cell. Okay, and these are often abbreviated to T for T cell, and then you put a subscript C for short. Then what will happen is this cytotoxic T cell will undergo division. So it first differentiates, then it divides to produce a whole population of cytotoxic T cells, and I will put circles around them to indicate that they are cells. And of course, again, I've drawn 4, but you will make thousands, if not millions, of these things. Okay, now these warriors will leave the lymph nodes and they will gush into the blood. Okay, so they go into the blood firstly. Then what will happen is they will be recruited at the site of infection. So they will then cross the endothelium at the site of infection and they will go into the inflamed tissue. So the endothelium will have all sorts of molecules on it which will help these cytotoxic T cells to be recruited there. So that's part of the activation of the endothelial cells. Okay, so you won't just get these cytotoxic T cells going anywhere in the body. They specifically extravasate at the site of inflammation. Okay, the endothelial cells in a perfectly normal portion of tissue will not bind to cytotoxic T cells, or at least should not bind to cytotoxic T cells, and should not therefore move them into the interstitial fluids. So they'll only go into the inflamed portion of tissue. Okay, and now what will they do? Well, they will go and look for cells which are infected with the intracellular pathogen. Okay, now this portion requires us to understand something about antigen presentation. So, basically, antigen presentation is not something that is special for dendritic cells, macrophages, and B cells. Those are what are known as the professional antigen-presenting cells, because they are capable of actually activating naive T cells. Okay? However, any cell in the body, so let's say this is a normal cell, but for the fact that it has got a virus in, okay? But in fact, any cell, it doesn't need to have a virus in it. Well, any cell, let's just say this is a normal cell, any cell is capable of putting antigen fragments on its surface in MHC class 1, which I'm drawing here. Okay, so all cells have MHC class 1 on their surface. Well, there are a few exceptions. All nucleated cells have MHC class 1 on their surface. Non-nucleated cells, such as red blood cells, won't have MHC on their surface. However, all nucleated cells have MHC class 1 on their surface, and they are continuously breaking down antigens and sticking them on the surface. So, if this cell becomes infected by an intracellular pathogen, such as a virus, it will put antigens of that virus on its surface in this MHC class 1, okay, or at least fragments of this antigen bound to that MHC class 1. Okay, now, when the cytotoxic T cells come into the inflamed tissue, then basically they have on their surface a T cell receptor and also CD8 molecule, which will recognize this antigen fragment which they were armed against, basically. So they will bind to this MHC class 1 with the antigen fragment. The CD8 will also bind to the MHC class 1, and then what will happen is this cytotoxic T cell will then know that this cell is infected with the pathogen that it was intended to destroy. And basically it kills this cell. It tells this cell to commit apoptosis. So it's going to induce apoptosis in infected cells. Okay, now basically what happens in apoptosis is that everything that is within the cell gets destroyed. So all of the intracellular pathogens that are within this cell are just going to be destroyed in the process of apoptosis. So that's why this is an effective strategy. It's a suicide strategy, but when these cells commit suicide, they destroy any intracellular pathogens that are within them. So basically, the cells will commit suicide. A few million or God knows how many cells will commit suicide to save the meta-organism. And when you think about it, it makes sense from the cell's perspective because the other 100 trillion cells of the body are genetically identical to it. So actually, by sacrificing itself, it is saving the other 100 trillion copies of itself. So by sacrificing itself, it's saving itself. So there's a nice little way to end this discussion. So, the important thing to gain from this, the whole purpose of this talk on the immune system, was to understand that T cells are going to be being recruited into the site of inflammation. So cytotoxic T cells were coming into the site of inflammation. T helper 1 cells were coming into the site of inflammation. Even though I didn't mention it at the time, the T helper 2 cells also end up coming into the site of inflammation. It's a little bit more difficult to understand why they would want to bother, because, you know, their role is back in the lymph node helping the B cells, and B cells do not get recruited into the site of inflammation, at least not initially. In tertiary lymphoid organogenesis, they're going to start being moved, but it won't be these plasma cells which are actually producing antibodies which are being moved into the inflamed area. They stay in the blood, they don't go into the inflamed tissue. Okay, right, so we'll continue this discussion in the next video.